Started off in the hospital, L&D, right? Pretty cool. After that, went to 3rd Battalion, 4th Marines in 29 Palms. Loved it. Thought I was gonna get out. Went to X-ray tech school. Didn't like it, but you know what? Got my certs. All right. Then the recruiter came by my command, said, "Hey, what do you want IDCs in the fleet?" And I said, "Hey, sign me up." And I've loved it since then. Okay. So today we'll be talking about Bumedinst Instruction 6010.13 Quality Assurance Program. This is probably not the first time you've seen this instruction on the test, right? So my advice, make sure you memorize that nomenclature right there. Okay? That's half the battle is knowing the instruction number, the title. Okay? If you can't read it out of your answer bank on that test, you know, that's part of you not studying that first part right there, which is just the title itself. All right.
What's the 6000 to 6099 series?
What is it?
No, the sub one, 6000 to 6099. General admin, right? So you're seeing here is QA is going to be the administration of a certain program within there. That's why it falls into the 6010 series.
And what's the purpose of this? This instruction establishes policy, published procedures, and assigns responsibility for quality assurance and risk management activities in Navy fixed and non-fixed medical dental treatment facilities, okay? MTF and DTF. So that counts the hospital, the clinics under it, like, and the EMFs as well, okay? Again, this doesn't have the ships under it, okay? Just naval MTFs and DTFs, that's it, okay? The Chief of Naval Operations and Commandant of the Marine Corps are responsible for ensuring the highest quality of medical and dental care provided to active duty and their beneficiaries. Again, they're overseeing the whole program, right? Just like HM1, what was his name again? Nelly mentioned earlier. They're the ones that oversees this program, but they don't establish it like the CEOs do in the commands, okay? That's why it's red. Make sure you guys remember that. All right. So quality assurance is the formal and systemic exercise of monitoring and reviewing medical care delivery and outcome. Design activities to improve healthcare and overcome identified deficiencies in providers, facilities, or support systems in carrying out follow-up steps or procedures to ensure that actions have been effective, that no new problems have been introduced, and that individual improvement in quality as a result of process improvement is maintained. Why do you think this is so important? What do you think, HM3? On your take, just reading this, why do you think it's so important that we ensure that we're giving the best quality to our patients?
So if there's any issues, that they're addressed sooner rather than later.
Right. Okay. I don't care what rank you are the eyes and ears of Navy medicine. All right, you're representing the CEO of that command. Whenever you see something that's messed up, what do? You just stand by, you act on it. Act on it, right? All right. Why are those dates red? What do you think? Probably important, right? So let's get a little background on this. So the QA program was originally issued in 1984. Okay, originally issued. Now, in 1987, procedures and responsibilities were issued in afloat and ashore naval MTFs. Okay? So look at the keywords on that. Originally issued, right, to standardize the QA in Naval Medical Command MTFs, right? And then in 1987, they actually they issued it to the responsibilities to enable MTFs and DTFs afloat and ashore in 1987. All right? And then 1989, incorporated into the instruction. Okay?
So an easy way to think about this, because the infection control program actually did this, right? You used to have Bumedinst Instruction 6020.9 alpha, and then you used to have your Bumedinst Instruction 6000.13, which is your dental. So they had a medical infection control and a dental infection control, and they said, screw it, these should be combined together and pushed together as one huge program, right? Same concept here. They took ashore facilities and they took afloat facilities with QA, and they said, let's combine it together and make it one and put it together in 1989.
Yeah, so there's less paper to look into, right? It decreases the confusion and the potential of confusion. All right, so applies to all healthcare personnel providing services and naval MTFs and DTFs. Fixed and non-fixed. Policy. Medical and dental employees, active duty, reserve, and civilians will participate in ongoing monitoring and evaluation process designed to assess the quality of service provided. Again, we are the eyes and ears of Navy medicine, okay? Along with your civilian counterparts in your workspace. All right. All fixed and non-fixed MTFs and DTFs will have a QA program. Okay, this is applied to the ship. Let me ask you that.
Yes.
Does it? They must gain and maintain accreditation by Joint Commission on Accreditation of Healthcare Accreditation. That means, no, JCO don't go on your ship. They don't touch it. Who goes on your ship? You ever see them around? Who?
MRD.
MRD. Okay, they're the ones that QA our stuff on the ship. Okay? The rules don't apply, a lot of rules don't apply to the ship. What you're looking at is the 6000 series. Alright? You guys know what I'm talking about. Who's been on a ship? Who's actually worked with MRD before? Pain in the ass, huh? Yeah. You gotta really look at that check sheet, man, to pass that inspection. Okay, to get that blessing. Okay? Alright, so individuals must be afforded education opportunities to commensurate with their responsibilities in running a QA program. Information derived through the QA process must support performance appraisals for privileged practitioner, clinical staff, and all other healthcare personnel. Okay, here we go. This is important right here, okay? Routine. Documentation must remain on record in a secure location for a period of 5 years. Why do you think that is? Why do you maintain those routine documentations for?
Do you want it to make sense on why this one's 5 compared to 2 and everything else, right? What is the purpose of this instruction? It's to improve the quality of healthcare facilities, right? So if I want to improve the quality, do you think I would only want to look at 2 years worth of how these programs are running? I want to see at least a 5-year worth time frame to see where the growth, where the changes are, what's worked, what's not worked. That's why I have, for QA at least, I have 5 years worth of routine documentation.
Yes, you want to see where your shortcomings are. I mean, let's get real, right? A lot of commanders get comfortable, just want to maintain what they're comfortable with. Okay, that's why you want to look at good of 5 years of documentation. Where can I improve to make the process better in my facility? Right? If you were in charge of the place, that's what you're going to look at. It's like where is our performances falling? Where can we improve it? Okay. Potentially compensable events, PCE, and Judge Advocate General JAGMAN investigations must remain in a secure location and on file for 2 years with the local command. All right, don't get those two numbers mixed up. All right. Again, what's the importance of keeping those documents? All right. What if we had a case that you were investigating, and maybe the evidence was needed outside of the Navy? Okay. That's why they want to keep those records. All right, they're very important. And guess what? That might be one of your patient documentations too. All right, so that's a reminder for you guys. Hey, when you're documenting stuff for your patient, make sure it's squared away. What if your documentation happens to fall under a PCE investigation? You want your stuff squared away, right? All right, objectives of the program. Monitor medical and dental services being rendered, right? Decrease potential risk. I mean, look at all of this, right? You guys are the front lines. It starts with you. All of this. Okay? You might not be the big wigs up top, but you're the workers down there making sure that things are working fine. All right? You're the first line. That's going to be, potentially preventing a mishap. All right? Or making that patient's day, or making that crappy day. It's all up to you. It's all up to you and how you're going to carry yourselves, interact with those patients. All right? You want that 5-star Yelp review, right? That's what you want.
So this instruction too, for those that have been through Joint Commission, I need you to put that thought in your head right now on what you did to prep for Joint Commission. This instruction literally right here is the prep for Joint Commission. It is a QA review of all your programs doing your tracers, and then you have committees that meet to make sure they're meeting their standards and wickets every month, every quarter, so that it's a flawless inspection when Joint Commission comes through.
Yeah, and talk about your work centers. Nobody's bringing it up. Talk about it. You know? All right, requirements. So this program is guided by a plan at a minimum. The plan includes these, right? Program objectives, organization responsibilities, customers' input on quality of care, right? Highlighting that quality of care, right? How you're going to interact with the patient, the care you're going to render, very important. QA function, what is to be done, to whom and how frequently. Information flow and review needs. Annual review of program effectiveness. Collective data is collected to improve command and patient care. Okay? Do you guys have powers about that in your work centers? At all? Dang. Sounds like you should be discussing your work centers then, right? Something to bring up to your LPOs, okay? Even with you Greenside guys too. I know how it goes. BS medicine is way different from hospital medicine, right? But, I mean, you can throw in curse words in there, but show those Marines that you fucking care. All right? Because they're going to care about you too. When it comes to war, they're going to want to see Doc thrive and survive. Okay? My Marines put their butts out there for me, and so did I. Okay? So make sure you're giving them the quality of care that they deserve. QA programs continue. Shall generate both positive and negative information concerning patient care. Why do you want both positive and negative? What do you think, HM3? Do you want all positive all the time?
No.
Why is that?
You want to fix what's going wrong.
That's
and then
right.
continue what's going right.
Right. And if you mess up, own it. Okay? Write it down. Talk about it. This is how I messed up. I think I have a solution. Can I talk about it with you? Okay? Because you don't want to come in there with a problem with no solution. Okay? Never do that. When you make a mistake, come up with a solution and then propose that solution and then talk about it. All right?
I think that's just a trait in general you guys need to have, is having the vulnerability to be able to admit that you make mistakes, because if you don't, then that mistake will always occur, and then you'll never fix it to move forward. So I want that concept to resonate with you and all the sailors around your areas. Otherwise, it'll always be that shit you guys always talk about at commands, that things never change, they never fix, because people avoid mistakes instead of facing them head on.
Yeah. There's no such thing as perfect, guys, especially in medicine. Medicine is a practice. There's no perfection. So if you're messing up, don't be afraid to reach out for help, okay? People will help you out, but all it needs to take for you is to communicate. We're not always going to be in our phones, right? This is why we're humans. We interact with each other face to face. I see you, you see me, you see my emotions. Talk to me, okay? I will take care of this, and from there, if you can't come up with a solution on your own, then let me help you, all right? All right, so again, provide comprehensive monitoring of activities to that encompass all patient care services. Evaluate collective data to improve patient care services. Document findings, conclusions, recommendations, actions taken, follow-up action, and resolution. All right? Just reading all of this looks like there's a lot of communicating going on there, right? And again, it just takes that one moment where you have to talk about the mistake that was made. Very important. Not everything is always positive after all. Negative things happen. Okay? All right. So, NTF or DTF facility-wide functions. Let's talk about it. Both are required to have programs for continuous monitoring of the quality and appropriateness of health care. These programs will review data on demographics of the patient population. There you go. Customer needs, expectations, productivity of the healthcare facility, outcomes of care, occurrence screening, resources, management, and effectiveness. Okay. See the first two right there? Right? Most of you will be a huge part of that right there. Okay? Are you providing the customer's needs? Are you meeting their expectations? Okay? When you're dealing with a patient, or should I say customer, your expectations out the window. Alright? You should be meeting their expectations as a customer and the patient. Even if it means just swallowing your pride and just taking the hit. Alright? Because a lot of times when people are just disgruntled, they're going to show how they really feel when it comes to their medical care. Because right now, right, I don't know if you guys notice this, but appointments are back the hell up, right? people are probably frustrated. Right? Just let them talk about it. Maybe they're the one that you're the person that they want you to listen to them because they're just so frustrated. Okay? And they'll remember you for that. Like, hey, this person just listened to me. They didn't judge. Just let me all listen. They just let me voice my frustration. That's also part of your personality right there. Okay? All right, risk management. A lot of things to talk about right there. Okay? So all treatment facilities must fully integrate into their QA program risk management procedures requiring review of cases and events that represent liability or injury risk to patients and staff, and must recommend methods of decreasing liability risk. The risk management program must include the middle things right here. Y'all remember ORM on the ship? Right? Same thing. Okay? Who's heard of ORM here? Who hasn't heard of ORM? All right. So, operational risk management, right? Cons and pros. Okay? This is what you're looking at. All right? So like I said, if you see something wrong, talk about it. Bring it up. So you can mitigate the risk. Okay? You can't prevent the risk all the time, but you can mitigate it. You can decrease of it from happening. All right, medical staff functions. Monthly review of department or service minutes. Report outcomes of facility-wide monitors, surgical case reviews, blood usage review, drug usage evaluation, pharmacy and therapeutics review, medical record review, credentials review, privileging, practice volume data. Okay, when you have a chance to work on this, or you're seeing someone that's working on this kind of stuff, jump into it. All right, so you can get some experience and get your hands dirty, and so you can fully integrate yourself into how this program works. Okay, when you do your record reviews for your departments, you're already doing that. All right. Dental staff, monthly review of department of service minutes, report outcomes of facility-wide monitors. Basically the same thing, but just less, as you notice. Okay. All right. The committee. Inpatient fixed MTS must have the following standing committee. ECOMS, responsible for all medical staff functions. QA committee must meet at least monthly. Safety committee and infection control committee. I'm sure some of you are part of these committees, right? Are y'all? Yeah? Okay.
So I want to make this make sense to y'all, right? So the CO at each command, he has this wardroom of officers. He appoints all these positions for the officers. He has an infection control officer. He has a safety officer. He has a pharmacy control officer. He has all of these different roles, right? So what he has is those officers all meet together as the quality assurance committee. Say, hey, how can we make this facility better every single month, okay? And then they need help, right, from people that are seeing the day-to-days. So that's when they have infection control petty officers and safety petty officers from each of the divisions, right? And they say, hey, to this month the safety committee is meeting to talk about what do you experience. Infection control saying, hey, are we doing our hand hygiene surveys? So that way they can take all that data back to the CO and tell them how their program is running within the hospital or facility. Does that make sense to you?
Yeah, give us something to talk about. Again, record what you see and see on the floor. Okay, see and hear. Again, it's not all about positive. Give us some negative feedbacks as well. Okay, so you can expound the improvement that the program needs. Fixed ambulatory care medical facilities must have the following standing committees. Again, ECOMS, the QA committee, non-fixed MTS, the privileging authority must have ECOMS, and a fixed non-fixed dental facility, privileging authority must have ECOMS. I think I've seen these two. You should take note, especially the monthly meeting. I've seen that plenty of times, so make sure these two right here, you take note, okay? You guys good? Still writing.
You know what the ECODs are, right? It's dental. So you got your econs for medical and your ECODs for dental.
The key letters, M and D. That's it. All right. moving on. Alright, here we go again with the responsibilities, okay? Chief of Bumed must submit an annual QA program summary report. Please write that down. Seen that for sure. Fleet commanders in chief, TICOMs, OICs of Naval Healthcare Support Offices, CO, OICs, and SMDR facilities, Naval School of Health Sciences, Bethesda, Maryland. Alright, for them, they conduct 2 educational workshops each year on the principal components of the QA program. That goes up with the ECOMs too, right?
Yep.
That's what they do. Yep.
So, couple things I want to hit on, right? What echelon, or who do you think your fleet commander in chiefs are? What echelon do you think that is? Oh, sorry, yeah. Your fleet commander in chiefs are echelon 3. So it's going to be your regions, your NMFA, your NMFL, right? Now, your TICOMs, what do you think that one's going to be? What echelon? 4. So you would have a type commander here up at Portsmouth and some of your other big major hospitals, right? Now the workshops, to make it make sense, they do 2 workshops every year because as BUMED and Navy Medicine, if you've not seen, they are constantly always changing with new programs, policies. CDC comes out with new guidelines, whatever else. So they have 2 workshops every year to talk about those new changes so that we are all up to date as practitioners and making sure we are practicing the current medicine within our environment and facilities. Does that make sense?
You guys still need time with this slide? You're all good. Okay, moving on. Almost there. Report requirements. Alright. Fixed medical and dental treatment facilities must forward an annual assessment of the preceding fiscal year's QA program to Med 3C4 with the following. Hey, hold it. Okay, really take notice, okay? Annual assessment of the preceding fiscal year. Okay? Fiscal year. QA program. Copy to cognizant responsible line commander and must reach UMed by 15 January of each year.
So I want to explain one thing.
I promise you it's gonna be on your test.
I want to explain one thing because I'm going to do right now where I know that things are going to confuse you on the test. You just heard about an annual thing also being submitted by BUMED, right? So you need to pay attention to the key words that are in the question, right? BUMED submits an annual QA program summary report. And then the one that each one just mentioned, the fixed medical and dental TS submit an annual assessment of the preceding fiscal year's QA, right? So look for the keyword preceding fiscal year to know that they're talking about the fixed, and then look for summary report to know that they're talking about chief of UMA, because you're going to pay attention to annual assessment, and it's going to throw you off on the test.
Are they both due by fiscal year, or is it one is just whatever?
One is more calendar, one is fiscal. So you got to really look at the annual assessment, okay? Of the if the preceding fiscal. So like you really got, like I said, it goes down to carefully reading the question, okay?
So to answer your question, this is just like anything else. It's not going to be the same date. It's like evals, right?
Yeah.
You're going to have your evals are due by March 15th, but your eval needs to get to your LPO by January 15th, and it has to get to your chief by February 15th, so that way you can receive it by March 15th. Same kind of concept. You're submitting this to BUMED by 15 Jan so they can put it together in their QA program summary report of all of the activities and what their QA is. Does that make sense?
It's a little bit confusing, but like I said, just look for the keywords, okay? Remember them as much as possible. And just try to think yourself how it will flow. Okay, reports again. Risk management case reviews and malpractice information reports will be documented on the following. The management information reports required will be documented on the following. Report control symbol MED 6010 TAC 24, MED 6010 TAC 25. Reports are approved for 3 years from the date of this instruction.
So those are reports.
Definitely write those two down over there.
This one is for your risk management case reviews and malpractice information reports are put on there. So it's usually going to be like your JAGMAN type forms. Another term you've probably heard is root cause analysis. If you ever heard of that in your facility, same kind of concept. If something, a safety event happens and they have to go investigate it, put it all together, and then they submit it on something similar to this form.
You guys got it? Okay. Any questions? Sure.